In the Philippines, eating is practically a national sport. It's how we speak our primary love language. Every major life event, weekend, and impromptu gathering is built around a table that looks exactly like this. We approach these meals as a starting point, using a side of sausawan, like patis mansi or toyo with chilies, to personally finish the flavor profile of every dish. This data tracks the impact of that diet on the national health. Between a quarter and a third of all Filipino adults are hypertensive. Scaling up, that is roughly 14 million people navigating dangerously high blood pressure. The urgency for these millions of patients stems from two very specific, terrifying outcomes: suffering a sudden, paralyzing stroke, or facing the crushing, ongoing financial drain of regular dialysis treatments. This creates a brutal conflict. The very foods that bind families together are the same ones driving a massive public health emergency, forcing millions into an agonizing choice between physical survival and their social belonging. When a patient gets that hypertension diagnosis, the standard clinical advice is swift and severe. Doctors typically prescribe a strict regimen: steam everything, avoid fatty meats, and completely eliminate salt, bagong, and soy sauce. While medically sound, this restrictive approach functions as a social death sentence. A fiesta or a wedding loses its communal joy when you are entirely cut off from the shared flavors of the celebration. Imagine showing up to Noche Buena, the most important family meal of the year, and being the only person pulling a separate container of plain, unseasoned food out of your bag. The psychological burden of that isolation is heavy. Faced with that reality, countless pre-hypertensive Filipinos make a quiet calculation. Rather than losing their connection to their community, they simply ignore their doctors and return to their normal diets. Patients often prioritize cultural connection over clinical advice because the isolation of eating alone is a harder burden to bear than the long-term risks of the disease. Reversing this trend requires a strategy called Ang Sikreto ng Masarap na Bawal, the secret of delicious forbidden food. It moves the focus away from flavor deprivation and toward flavor substitution. The mechanism relies on the triple ASM method. By overwhelming the palate with intensely sour and rich umami profiles, you can effectively trick the brain into forgetting that the intense salty kick is missing. Commercial solutions like low-sodium soy sauce often cost 3 times as much as regular bottles, pricing out the vast majority of working-class patients on a tight budget. But this substitution method relies on local, deeply traditional ingredients. Souring agents like calamansi or batuan are incredibly cheap, and in many provinces, they grow freely right in backyard gardens. By leaning into sourness, this approach democratizes the hypertension diet. It makes managing blood pressure financially viable while keeping the meals firmly anchored in local Filipino culinary traditions. Before raiding the pantry, we have to establish strict medical boundaries. This dietary strategy is a supportive lifestyle measure. It does not replace prescribed daily medications like losartan or amlodipine. There is also a severe risk known as the kidney trap. A significant percentage of hypertensive patients also suffer from early-stage chronic kidney disease. For those patients, specific souring agents are highly dangerous. Fruits like camellias and the star fruit contain high levels of oxalates and neurotoxins, which are actively toxic and potentially fatal for compromised kidneys. Additionally, massively dialing up the sourness of your daily meals can trigger hyperacidity or GERD. Anyone with a sensitive stomach needs to moderate their intake of these intense citrus flavors. While adjusting these flavor profiles provides a cultural workaround for blood pressure control, it requires careful navigation. A patient should always consult their specialist before radically altering their diet. To put this theory into practice, social media communities have started promoting the Sasawan Challenge. The goal is to build a bright, fiery dipping sauce from scratch. You take fresh calamansi juice, aggressively crush in local red chilies, and perhaps add garlic or vinegar, completely bypassing the high-sodium soy sauce. The result is a vibrant, deeply familiar condiment you can take anywhere. You can sit down at a crowded wedding banquet, pull out your custom sasawan, and confidently eat alongside your family without feeling isolated. Lowering the risk of a deadly stroke does not require surrendering the simple, profound joy of eating a traditional Filipino meal. If a public health intervention is going to succeed on a national scale, clinical accuracy is only half the battle. To actually save lives,
the medicine must respect and integrate into the cultural heartbeat of the people taking it.